Hello, my name is Neela, and I'm going to start out with a little history of drug. We have been fighting drug abuse for almost a century. Four presidents have personally waged war on drugs. Unfortunately, it is a war we are losing. Drug abusers continue to fill our courts, hospitals, and prisons. The drug trade causes violent crime that ravages our neighborhoods. Children of drug abusers are neglected, abused, and abandoned. The only beneficiary of the war we are organized crime members and drug dealers. The United States has focused its effort on criminalization of drug use. The government has spent countless billions of dollars in effort to eradicate the supply of drugs. Efforts of interdiction and law enforcement have not yet been met, decrease in the availability of drugs in America. Apart from being highly costly, drug law enforcement has been counterproductive. Current drug laws need to be relaxed. The United States needs to shift spending from law enforcement and penalization to education, treatment, and prevention. Drug first surfaced in the United States in 1800s. Opium became very popular after American Civil War. Cocaine followed in the 1980s. Cocaine was properly used in health drinks and remedies. Morphine was discovered in 1906 and used for medicine purposes. Heroin was used to treat respiratory illnesses. Cocaine was used in Coca-Cola and morphine regularly prescribed by doctors as a pain reliever. Now I will talk about a balanced approach of prevention and enforcement and treatments that are the key in fight against drug abuse. The 2010 National Drug Control Strategy reports highlights three national priorities: stopping drug inhalation, reducing drug abuse and addiction, and disrupting the market for illegal drugs. Stopping drug inhalation. No one starts life wanting to be a drug addict. We must teach our children about the danger and consequences of drug use. Teach them what to do when they are offered drug and keep reinforcing these lessons. Research has shown that if a child can reach adulthood without ever having tried drugs, the chances of him ever being addicted are significantly low. The 2010 National Drug Control Strategy lays out a comprehensive support for prevention programs, including building a community-level activities, targeted substance abuse prevention programs in schools, and an institution of higher learning in the workplace, on the roads, in the military, and on the playing fields. This comprehensive approach means educating the public about the danger of drug use, as well as working with medical and pharmaceutical organizations to prevent the diversion of prescription drugs. Reducing drug abuse and addiction. Substance abuse treatment costs our nation over $1.5 trillion annually, and treatment can help reduce these costs by far more than the expense of that treatment. For those who end up hooked on drugs, there are also programs like drug courts that offer nonviolent users the option of seeking treatment. Drug courts provide court supervision unlike voluntary treatment centers. Nationwide, 75% of drug court graduates remain arrest-free at least 2 years after leaving the program. The perception of risk also plays an important part in whether kids abuse drugs and other substances. Enforcing drug laws. Enforcement of our laws creates risks that discourage drug use. Laws which clearly define what is legal and illegal and send a strong signal for young and old alike what the boundaries are. Price and availability can also affect the choice of whether to abuse drug. Strong drug enforcement affects the price and purity of drug and impact demands. A study released in 2005, Marijuana Use and Policy, What We Know and Have Yet to Learn, by Rosalie Piccolo, found that price matters and marijuana prevalence rates are responsive to change and perceived risks. Thank you for listening.
The criminalization process currently in place in the United States is not effective in curbing illicit drug use and abuse. The system currently states that it is a crime to carry prohibited drugs. The punishment could vary from a fine to a prison sentence depending on the drug, the amount, and whether it was for personal use or for sale. Unfortunately, this process is not helping drug users, therefore it really isn't getting rid of the problem. 50% of sentenced inmates in federal prison were serving time for drug offenses. 50%. That's a lot. What if those 50% were offered help and sent to rehab instead of simply being placed in prison? Rehab is a lot less expensive than incarceration, and as rehab helps people There will be lower costs related to incarceration because rearrests will decrease. If only 10% of drug addicts received rehab instead of jail time, the criminal justice system would save $4.8 billion. Placing someone in prison is not helping the drug user. Instead, it is only causing withdrawals which will be fulfilled when they are released. Drug addiction is like a disease which needs help being cured instead of being punished for. Murders, robberies, kidnapping, and many more are the real reasons to be in prison and punished. Rehab will help that same drug user understand the negative aspects of drugs and help them live their life drug free. As addicts continue to get help, the drug abuse rate will slowly but surely go down as well. It is all about preventing drug abuse, and only being punished for it will not solve the problem. The addict will be afraid of the punishment instead of knowing why they should not use drugs. This will lead to using drugs secretly and hiding it, but it will not end it. Rehab will slowly help stop them from using drugs in public or alone because they will remember how it negatively impacted their life. Drug dealers should be in prison, not the addicts. If drugs were not as easy to access and people weren't distributing them in the streets, then there wouldn't even be that many addicts. It is a supply and demand concept. If there isn't any supply from the beginning, then where will the demand come from? It won't. The criminalization process really needs to be reconsidered and focus on helping people instead of taking the easy way out and placing them in prison.
Hi, my name is Robert Ney, and I'm here for Group 3 to talk about criminalization of illicit drug use. And I'm also trying to advocate for the point that the criminal justice system isn't exactly working in today's society when it comes to drug use and abuse. So, with criminal sanctions against drugs, it's not truly a punitive tool. The biggest thing is we are usually sending people that are addicts or people that really need of treatment to jail or for correctional facilities as opposed to actually for them to receive treatment. And actually, 1/3 of all treatment referrals in the United States is currently from the criminal justice system, not so much from a healthcare facility or other advocates of that nature. So for that, the drug courts, it's not exactly, they rather end cases really quick. And thus, the people that really need the treatment, as in the addicts in particular, or people that just recently got addicted to them, are not getting the help they need. This is, when it comes to anything about the criminal justice system, the people that should be receiving any disciplinary action are the people that are really developing the drugs or creating the drugs or growing like hemp or anything like that, along with people distributing them, not so much the addicts themselves, because they're the ones that make money off of. The war on drugs really has sent like millions of people to prison for just the smallest offenses. I mean, you have people in jail easily for about a year or two, just basically for smoking weed or doing small amounts of heroin, as opposed to really give them the help they need, which in turn really costs a lot less money, which I'm going to talk about in about a minute. But when it comes to this, about 2.3 million people are set behind bars in this country, and majority of them since 1987 have been locked up for mostly drug offenses. Now, when it comes to legalizing drugs, I understand that there's a whole debate on legalization of marijuana, which is another topic that was covered by the previous group. But for example, with if we were to tax anything on like drugs right now, whether it be marijuana, heroin, and legalize it, I mean, we don't really make too much money off it. Back in 2002, we made about federal taxes collected about $8.3 billion, which only 4.5% of that is closely related to alcohol costs. It's really based on healthcare spending and things of that nature. It really doesn't reflect well on. We really don't make money off taxing drugs and that kind of stuff like that. The biggest thing we have to also look at too is whether drugs, even if we try, like even if we keep banning drugs, the fact is that there's an underground market, there's organized crime that still goes on. That's been going on since the 1800s. So it's really like, so pretty much if there's a demand and there's a need for it, and especially since illicit drugs can be high value, people are going to find means and ways of getting it. It's no different from gun control or anything else. If criminals are going to sell it, they're going to get their hands on it. I mean, legalization advocates claim that the fight on drugs has not been won, and in fact, they believe it's unwinnable. Now, ever since since like 1950. Things have really gone up in terms of like drug control, but it necessarily isn't going to stop anytime soon. As long as like they make things illegal, some people are going to find a means and ways of really dealing with that. I mean, when it comes to that, drug control spending is a very, very small portion of our budget in comparison to everything else when it comes to healthcare, military, and all that. So the compared to the social cost of drug abuse and addiction, the government is spending very, very minimal on drug control, and about taxpayers about every year are spending about $70 billion in corrections and incarceration. So we're spending a whole lot more money keeping people in prison as opposed to really getting them the health care they need. And that's one of the things I like to point out is I feel we're not really the criminal justice system is not working, and if we want it to work, we need to actually help the people that overcome the addiction as opposed to incarcerating them and then releasing them about 10 to 25 years later and then still picking it up all again, because all we did was just waste time and waste a whole lot of money keeping them in prisons, giving them food, clothes, all the other stuff that they don't they could have gotten just with healthcare. So that's all I'm going to talk about today, and the rest of the group will go over the different legalization processes.